No decision without me. About me without me. Andrew Lansley, how do you make this real?
Thanks. Our starting point was the annual patient survey and the finding that in inpatient settings, about 50% of patients report that they're not as involved as they would like to be in decisions about their care. And we thought that's not a bad place to start, and we were thinking about what would be the indicators that trusts took no decision about me without me seriously. One of them would be that they'd want to know what that figure was for their local trust. They'd want to know how it was composed, what drove that number, how they could get that number up. And that would be about a number of different things. It would be about a culture of really wanting to understand what matters to individual patients and recognising that there's a huge diversity among the patient population, from those with chronic conditions to those with minor acute episodes and everything in between. We'd want to look for evidence that trusts were doing some of the things that we know are components of shared decision making. That would include people having access to their records, people having care plans, a focus on measuring patient experience, some of the things that we talked about on the other tables. We also talked about the importance of taking a leaf out of John Lewis's book of whether trusts were recruiting the right kind of people, training them in the right kind of way, and then continuously developing in the right kind of way, so that they had the skills and behaviours that were around genuinely sharing decisions with their patients. We talked about the importance of trusts involving not only patients but their carers, but in an appropriate way, not assuming that carers stand in for the patient, but they have an important view as well. We thought that commissioners ought to care about and monitor the extent to which trusts were doing this across the piece. And we also talked a bit about sequins and whether they were a lever for ensuring that commissioners had some grip on whether trusts were doing this in practice. It was about some of the detailed practices of shared decision making, something about the culture, something about the kind of staff that you have, and really focusing on how you get that figure of how many people feel they're as involved as they want to be going up.
For no decision, sorry, for no decision about me without me, the public needs to know all of the information that is going on in the hospital. What struck me at the public inquiry is just how much data the NHS collects. If I'd have known just how dangerous Mid-Staffs was, there's no way my mum would have gone into that hospital. Cure the NHS believes that anonymised SUIs, anonymised complaints, incident forms, all anonymised, should go into the local library on a 3-monthly, if not a monthly, basis. And anybody going into that hospital can see, oh, Ward 11, it's got those complaints, those serious underward incidents gone on. Only then have we got an informed decision to go into that hospital, and it would be no decision about me without me. We'd be informed then.
I think the work started by Wennerberg in Dartmouth showed that patient decision aids mean that patients get safer, more effective, better quality outcomes. I'd just be interested to know how many people are aware that 8 of those were published on NHS Choices earlier this year, and are available, and would immediately mean that more people could have decisions made that they wanted. And yet, I don't think, I'll bet you only 10% of people in this room know that those are available.
But Julie's point is that not everyone's going to go and look or even know about NHS Choices. Where are they most likely to go and get that information? It's probably in their local communities.
The profession should be pointing them to it, but I don't even think the professions know they're there.
Okay, good point.
Okay. I think the points about information and being informed are really important, but I have a slight concern, which is I feel that, you know, if I was going to go into hospital and had to kind of take part in this, if you like, I wouldn't feel that I had to compile some kind of research project before deciding which hospital I wanted to go to. I think getting that information and making it available is very important, but one of the things that we discussed on the table is developing a more equal relationship and ensuring that the health professionals have the attitude whereby they regard it as a kind of standard part of their business, if you like, to fully involve the patient. So you don't need to go and do the research in the local library, because the clinician who's talking to you will actually tell you what they know and give, you know, and have that conversation with you on relatively equal terms, so that you can make that decision.
Point.
I just wanted to respond to Julie's point, because here it is. As a member of the public, this is the volume I get of all the SUIs and all the incidents and the root cause analysis from the Homerton Hospital. So, you know, there is an inch-thick pile of papers that I get every month, and I'm able to discuss the data inside this book and discuss recommendations. But you know, what does a member of the public do with that? And even if you know it exists, the real question is, how do we translate that into something that the public can use?
But it's better to have that.
Yeah,
than,
no, absolutely.
Than not at all.
No, I think it's really progressive. That, I don't know what happens at the hospitals, but it's really progressive that the Homerton Hospital makes this available. And this is a public document. You can all read it, and it's horrific.
Okay. But the point is, Foundation Trust can choose whether or not they share that information publicly.
Deb Hazel Rankin with the NHS. Can I just say that I personally do, from my personal experience, I want all the information available to let me know whether my loved one is safe in that hospital or not, and I want it in a user-friendly that I can understand.
Yeah.